I'd like you to go more in depth about the different medications people can use to treat pain. And first of all, how often do the patients actually that you see use medications along with the occupational therapy?
Yes, that's a very good question. Now, many times these kinds of conditions are treated with very conservative type of medicines, over-the-counter stuff, NSAIDs, non-steroidal anti-inflammatory drugs, non-prescribed. So they can manage it, ibuprofen, that kind of thing, help us bring down the swelling. They'll be taking it before they get to me. The patient will, you will probably be taking it even during the course of therapy. I may encourage you to maybe use it, and I may encourage you to maybe get off of it as well. So it is very common for them to use the medication during, before, and even after a course of therapy.
But is ibuprofen for acute pain or chronic or either?
I would say ibuprofen is used more for the chronic cases. A very acute onset, very aggressive onset of pain, you're most likely going to end up seeing a doctor, and the doctor may prescribe something more aggressive, maybe a prescribed NSAID, not necessarily a narcotic. Narcotics or opioids are normally reserved for patients that are status post-surgery, or maybe have just gotten to that point where the pain just doesn't resolve with any other more conservative means, and they're not maybe a good surgical candidate. And that in that instance, you would be prescribed a narcotic, but mostly not for your everyday aches and pains.